information in this video has been prepared using the package insert of the drug. If this video is useful for you, don't forget to like the video and subscribe to the channel for support. Ultram, a drug from the group of narcotic analgesics, is available in 50 mg and 100 mg tablets. Ultram is also available in extended-release capsule form. The active ingredient of Ultram is Tramadol. What is Ultram and what is it used for? Ultram belongs to a class of drugs called opioid analgesics. Ultram is a prescription medicine used to treat symptoms of moderate to severe pain. Ultram may be used alone or with other medications. Doctors prescribe Tramadol to manage moderate to moderately severe pain. Extended-release tablets are used for moderate to moderately severe chronic pain in adults who require continuous treatment for an extended period. How to use Ultram? Ultram comes as a tablet, a solution, an extended-release tablet, and an extended-release capsule to take by mouth. The regular tablet and solution are taken usually with or without food every 4 to 6 hours as needed. The extended-release tablet and extended-release capsule should be taken once a day. Take the extended-release tablet and the extended-release capsule at about the same time of day every day. If you are taking the extended-release capsule, you may take it with or without food. If you are taking the extended-release tablet, you should either always take it with food or always take it without food. Take Tramadol exactly as directed. Do not take more medication as a single dose or take more doses per day than prescribed by your doctor. Taking more Tramadol than prescribed by your doctor or in a way that is not recommended may cause serious side effects or death. Your doctor may start you on a low dose of Ultram and gradually increase the amount of medication you take, not more often than every 3 days if you are taking the solution, regular tablets or orally disintegrating tablets, or every 5 days if you are taking the extended-release tablets or extended-release capsules. If you are taking the solution, use an oral syringe or measuring spoon or cup to measure the correct amount of liquid needed for each dose. Do not use a regular household spoon to measure your dose. Ask your doctor or pharmacist if you need help getting or using a measuring device. Do not stop taking Tramadol without talking to your doctor. Your doctor will probably decrease your dose gradually. If you suddenly stop taking Ultram, you may experience withdrawal symptoms such as nervousness, panic, sweating, difficulty falling asleep or staying asleep, runny nose, sneezing, or cough, pain, hair standing on end, chills, nausea, uncontrollable shaking of a part of your body, diarrhea, or rarely, hallucinations. Ultram should not be used to treat pain in children younger than 12 years of age, and it should not be used to treat pain after surgery to remove the tonsils and/or adenoids in children younger than 18 years of age. Children between 12 and 18 years of age who are overweight or have breathing problems such as obstructive sleep apnea or severe lung disease should not receive Ultram. Things to know before using Ultram are: before taking Tramadol, tell your doctor or pharmacist if you are allergic to it, or if you have any other allergies. This drug may make you dizzy or drowsy. Alcohol or marijuana can make you more dizzy or drowsy. Do not drive, use machinery, or do anything that needs alertness until you can do it safely. Avoid alcoholic beverages. Talk to your doctor if you are using marijuana. Tramadol may cause a condition that affects the heart rhythm. QT prolongation can rarely cause serious fast irregular heartbeat and other symptoms that need medical attention right away. The risk of QT prolongation may be increased if you have certain medical conditions or are taking other drugs that may cause QT prolongation. Before using Tramadol, tell your doctor or pharmacist of all the drugs you take and if you have any of the following conditions: certain heart problems, family history of certain heart problems. Before using this medication, tell your doctor or pharmacist your medical history, especially of brain disorders, breathing problems, kidney disease, liver disease, diabetes, mental mood disorders, personal or family history of a substance use disorder, stomach intestinal problems, difficulty urinating, gallbladder disease, disease of the pancreas, obesity. Before having surgery, tell your doctor or dentist about all the products you use. During pregnancy, this medication should be used only when clearly needed. It may harm an unborn baby. Discuss the risks and benefits with your doctor. This medication passes into breast milk and may have undesirable effects on a nursing infant, such as unusual sleepiness, difficulty feeding, or trouble breathing. Breastfeeding while using this drug is not recommended. Consult your doctor before breastfeeding. What are the side effects of Ultram? Nausea, vomiting, constipation, lightheadedness, dizziness, drowsiness, or headache may occur. Some of these side effects may decrease after you have been using this medication for a while. If any of these effects persist or worsen, tell your doctor or pharmacist promptly. To prevent constipation, eat dietary fiber, drink enough water, and exercise. You may also need to take a laxative. Ask your pharmacist which type of laxative is right for you. This medication may increase serotonin and rarely cause a very serious condition called serotonin syndrome toxicity. The risk increases if you are also taking other drugs that increase serotonin, so tell your doctor or pharmacist of all the drugs you take. If this video was useful for you, like the video and subscribe to the channel. Share your views and experiences in the comment section. I wish you healthy days.